Hi, I am Triptan and I belong to anti-migraine agents. And now I'm going to share to you my drug information. So first, let's talk about my drug name. Triptan has 7 types of drugs, and these are almotriptan, elatriptan, frovatriptan, naratriptan, rizatriptan, sumatriptan, and zolmitriptan. And these were my generic names. Next, my brand name and chemical name. In almotriptan, my brand name is Axert, and my chemical name is on the right side of the screen. In elatriptan, my brand name is Relpax. In frovatriptan, my brand names are Frova and Migard. In naratriptan, my brand names are Emerge and Naramig. In rizatriptan, my brand names are Maxalt and Maxalt MLT. In sumatriptan, my brand names are Imitrex, Imitrex Statdose, Onzatra Exhale, and Zembracin Touch. And lastly, zolmitriptan. My brand names are Zolmig, Zolmig ZMT, and Zolmig Rapimelt. So now let's talk about my drug classification. In therapeutic, elatriptan, rizatriptan, frovatriptan, and zolmitriptan are classified as an anti-migraine agent, while naratriptan, almotriptan, sumatriptan are classified as a vascular headache suppressant and anti-migraine drug. In pharmacologic, I am classified as a 5-hydroxytryptamine 1 or 5-HT1 receptor agonist. Now in my pregnancy category, I belong to category B, which means animal reproduction studies have failed to demonstrate a risk to the fetus, and there are no adequate and well-controlled studies in pregnant women. And now in my mechanism of action, I constrict cranial vessels, and I inhibit neuropeptide release and reduce transmission in the trigeminal nerve pathway. And now let's talk about my pharmacokinetics. In almotriptan, I rapidly and extensively absorb in the GI tract. Protein binding is minimal and volume of distribution is high. Now active metabolites, monoamine oxidase A and P453A4 and 2D6 are responsible for the majority of metabolism, and 75% is eliminated through renal excretion. In elatriptan, I am well absorbed after oral administration. I enter breast milk and volume of distribution is 138 liters. And I am metabolized in the liver by CYP3A4 enzyme to the active and demethylated metabolite. And my elimination half-life is approximately 4 hours. In my frovatriptan, I rapidly absorb from the duodenum. I distribute it into cellular fraction of blood, and I undergo hepatic metabolism mainly by CYP1A2 isoenzyme, and my excretion is via feces and urine. And now in naratriptan, I rapidly and well absorb from the GI tract, and my volume of distribution is 170 liters, and I am metabolized in the liver by CYP enzymes into inactive metabolites, and my excretion is via urine, and my elimination half-life is 6 hours. In rizatriptan, I am completely absorbed following oral administration. Mean volume of distribution is approximately 140 liters in male subjects and 110 liters in female subjects. I am metabolized by monoamine oxidase, and approximately 14% of an oral dose is excreted in urine as an exchange, while 51% is excreted as indole acetic acid metabolite. In sumatriptan, I am incompletely absorbed from the GIT. I enter breast milk and protein binding is 14 to 21%. I am extensive first pass metabolism by MAO type A, and mainly via urine and via feces, and my elimination half-life is 2 hours. In zolmitriptan, my absolute bioavailability is 40%, and my protein binding is 25%, and my metabolism is I undergo hepatic metabolism mainly by the cytochrome P450 isoenzyme CYP1A2, and I am excreted via urine as metabolites and an exchange drug. So now let's talk about my indications. Almotriptan, frovatriptan, zolmitriptan, and rizatriptan are both indicated to treat acute migraine. While naratriptan is indicated to treat migraine headache. Sumatriptan indicated to treat acute migraine and cluster headaches, while elatriptan is indicated to treat migraine with or without aura. And now let's talk about my contraindications. I am contraindicated in patients hypersensitive to my drugs or to any of my components. I am also contraindicated in patients with ischemic heart disease, angina, and previous myocardial infarction, uncontrolled HDN or other significant underlying cardiovascular conditions, cerebrovascular disease, PVD, and ischemic bowel disease. Now let's talk about my side and adverse effects. In CNS, I may cause dizziness, somnolence, paresthesia, drowsiness, warm or hot sensations, weakness, fatigue, neck, throat pain, and tingling. In respiratory, nasal discomfort may experience. In ENT, I may cause visual disturbances. In GI, I may cause dry mouth, dyspepsia, and nausea. In cardiovascular, I may cause chest pain, flushing, and skin sweating. And lastly, nursing responsibilities before, during, and after. In almotriptan, before, assess patient's cardiovascular status, noting chest tightness or pressure, and monitor vital signs. During, give with or without food. Wait at least 2 hours after initial dose before giving repeat dose. Don't exceed 2 doses in 24 hours, and don't give within 14 days of MAO inhibitors within 24 hours of other 5-HT agonists or ergotamine containing or ergot-type drugs. After, tell patient to immediately report chest tightness or pressure. Inform patient that he may take drug with or without food. If second dose is needed, tell patient to take at least 2 hours after first. Caution patient not to take more than 2 doses in 24 hours, and instruct patient to avoid driving and other hazardous activities until he knows how drug affects concentrations and alertness. In elatriptan, before, monitor vital signs and assess for chest pain, tightness, or pressure. During, give first dose as soon as migraine symptoms arise. Be aware that first dose should be given under close supervision to patients with coronary artery disease. If headache improves but then recurs, give second dose at least 2 hours after first. And be aware that drug safety in treating an average of more than 3 headaches within a 30-day period has not been established. After, instruct patient to take first dose as soon as migraine symptoms occur. If headache improves but then recurs, advise him to take second dose at least 2 hours after first. Caution patient to avoid driving and other hazardous activities until drug no longer affects concentration and alertness. Tell patient to report chest pain, pressure, or tightness, and inform patient that drug won't prevent migraines and isn't effective against other headache types. In probatriptan, before, assess for cardiovascular reactions, especially signs and symptoms of myocardial infarction. Monitor neurologic status, particularly for indications of cerebrovascular accident, and check for rash and itching. During, give 1 tablet with plenty of fluids at first symptom of migraine. If headache returns, administer another tablet after 2 hours. Don't exceed 3 tablets in 24-hour period, and give first dose under close supervision if patient has coronary artery disease or other risk factors, and don't give within 24 hours of another 5-HT1 receptor agonist or ergotamine containing or ergo-type drug. After, instruct patient to take 1 tablet with plenty of fluids at first symptom of migraine. Tell patient he may take second tablet 2 hours after first if migraine returns. Advise patient to immediately report chest pain, and caution patient to avoid driving and other hazardous activities until he knows how drug affects concentration and alertness. In naratriptan, before, maintain especially close monitoring in patients with cardiovascular risk factors, postmenopausal women, and men older than 40. Assess vital signs and ECG, and monitor neurologic status closely. Institute safety measures as needed to prevent injury, and discontinue drug if serotonin syndrome is suspected. During, know that drug does not prevent migraine. Give only if patient's cardiovascular status has been evaluated and determined to be safe, and first dose can be given under supervision. After, tell patient to take at first sign of headache. Advise patient to take second dose at least 4 hours after first dose if headache has not gone away completely or has returned. Caution patient not take more than 2 tablets in a 24-hour period. Advise patient to avoid driving and other activities that are hazardous until he knows how drug affects concentration and alertness, and tell patient to avoid cigarette smoking. In rizatriptan, before, monitor patient's response to drug, assess for need for repeat doses. Assess vital signs and cardiovascular status, especially if patient has cardiovascular risk factors, and discontinue drug if arrhythmia occurs. During, place orally disintegrating tablet on patient's tongue to dissolve. Make sure swallows it with saliva only, and don't give with beverages. Don't give within 14 days of MAO inhibitors, because it may cause serious adverse reactions. And after, teach patient how to use the drug. Advise patient to peel black blister pack of Maxalt MLT with dry hands and place tablet on tongue. Tell him to swallow drug with saliva only and not beverages. Tell patient he may repeat dose in 2 hours if headache recurs, but should take no more than 30 mg in 24 hours. And inform patient with PKU that orally disintegrating tablets contain phenylalanine. In sumatriptan, before, monitor cardiovascular status closely. Be aware that drug may cause serious and possibly fatal cardiac disorders, and watch for neurologic and vision changes. Institute safety measures as needed to prevent injury. During, be aware that parenteral form is for subcutaneous use only. Don't give within 14 days of MAO inhibitors. Don't administer within 24 hours of other 5-HT1 agonists, ergotamine containing drugs, or ergo-type drugs. After, instruct patient to take as soon as possible after migraine onset. Teach patient to recognize and immediately report serious cardiovascular reactions. Explain proper drug use. Tell patient if doesn't prevent migraine. and advise patient not to use drug for more than 4 episodes per month, and caution patient to avoid driving and other hazardous activities. And lastly, zolmitriptan. Before, assess therapeutic response to help gauge drug efficacy. Watch for adverse cardiovascular and respiratory reactions, particularly dyspnea and chest pain or tightness, and assess blood glucose level in diabetic patient. During, place orally disintegrating tablet on patient's tongue where it should dissolve. Don't break orally disintegrating tablet in half. Note that each nasal spray unit is intended for one use only. Tell patient to immediately report shortness of breath or pain or tightness in chest or throat. Explain the drug is intended to treat migraine, not prevent it. Tell patient to remove orally disintegrating tablet from blister pack just before taking it and then place it on his tongue and let it dissolve. Instruct him not to break it and advise patient to avoid sun exposure and to wear sunscreen and protective clothing when going outdoors.